Hi everyone, I'm Dr. G. I'm coming to you from the United States of America, and in this video today we're going to be talking about just how contagious is that COVID-19 virus anyway. How is this determined and what does it mean? We'll talk about that in this video. So, just how contagious is the COVID-19 virus, also called by its official name SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2? Well, you probably don't need me to tell you that the answer to that question is, it's pretty contagious. That seems pretty obvious, doesn't it? But what does that mean exactly? And how does it stack up against other viruses? How do we determine this besides just watching TV and thinking, wow, this seems to be making a lot of people sick? More importantly, what, if anything, can we do about it? To answer these questions, we first need to look at a couple of definitions. For example, what's the difference between something being infectious and something being contagious? These two things sound like they're the same thing, but in fact, they're a little bit different. Infectious means that something is caused by a microorganism, say a virus or a bacteria, a protozoa, a parasite, a fungus, and that this microorganism will cause a disease in your body. It will cause a syndrome. It will cause symptoms like nausea, vomiting, diarrhea, cough, shortness of breath, things like this. Now, contagious is a little bit more specific. This means that it can spread from one person to another. If something is contagious, it is most likely an infection, unless we are talking about someone's enthusiasm being contagious or someone's smile being contagious. But aside from those metaphors, contagious, if something is contagious, it's probably an infection. But just because something is an infection doesn't necessarily mean that it is contagious. Now that might seem a little confusing, so let's look at some examples. Let's take yellow fever. Now this is caused by a virus that is called the flavivirus, or sometimes called the flavivirus, and generally speaking, it causes flu-like symptoms at first, particularly a lot of body aches, muscle aches, particularly in the back, but for most people, it will then go away. However, if you're one of the unlucky 15% or so, it will go on to cause severe liver damage, which then in turn will cause a person's bilirubin levels to go up in their blood, which then will make them become jaundiced, or in other words, they'll turn yellow, hence yellow fever. Now, yellow fever is definitely an infection. It's caused by a virus, but it's not considered contagious. And why is this? Well, that's because yellow fever can't spread from one person directly to another person. You could sit in a room with someone who has yellow fever all day long, and you are not going to acquire it from them. However, it is spread by mosquitoes. So if you get bitten by a mosquito that is carrying the yellow fever flavivirus, then you might acquire yellow fever. But you can't get it from another person, unless, of course, you and that other person are sitting in a room full of mosquitoes, I guess. But anyway, you get the idea. It won't spread directly from one person to another. It has to go through someone in between, like a mosquito or a tick or something else. There are other examples of microorganisms that cause infections that are not contagious. For example, malaria is one of them. It's also spread by mosquitoes. That's actually a parasite. Another example would be Lyme disease. Lyme disease is spread by ticks. The bubonic plague is, generally speaking, spread by fleas. So these are examples of infections that are not contagious, or at least aren't contagious under normal circumstances. We'll talk about that a little more in just a little bit. On the other hand, measles, which is also caused by a virus, is considered to be one of the most contagious infections known to man. It spreads directly from one person to another, and it does so by infected particles in the air. So this means that if someone is infected and they cough and they sneeze, or even if they just laugh or speak or even just breathe sometimes, they are putting those infected particles out into the air. And then if you breathe those in, you can become infected. So in the case of something like measles, all you really have to do is be around someone who is sick and breathe. That's wicked contagious. However, even for something as contagious as measles, if you're just walking down the street and you happen to pass someone who has the measles virus, you are not going to get that from them just from being very briefly within a few feet from them, unless maybe the person happens to just sneeze full on in your face as they go by. But that's unlikely. So most of the time that's just not going to happen, and it can't like reach across 50 feet of space and strike you like lightning or something. And thank goodness, because that would be terrifying. Even the most infectious viruses, the most contagious viruses, do have their limits, and thank goodness for that. However, if you are sitting in a room with an infected person, and say you're in that room for quite some time, hanging out with them and talking to them, and particularly if they are coughing and sneezing, and they're really spreading those particles into the air, then you are probably going to be sick. And that is especially true if you are not immunized against that virus, say with a vaccine or having previously had that virus yourself. And it's particularly true if you are not wearing the proper protective equipment, those PPEs that you've been hearing everybody talk about. And we'll go over those in another video. So there's a huge variability between how contagious one microorganism, a virus or a bacteria or a fungus or whatever, is compared to another. And how contagious they are depends on a large number of factors, and we'll go over those now. Perhaps the most important factor that determines how contagious a virus is the method of spread. So things can be spread the following ways. The first, which is also the most disgustingly named, is the so-called fecal-oral route. And yes, it's just as disgusting as it sounds. What this means is a person goes to the bathroom, they get some poo on their hands, they don't then wash their hands appropriately, then they shake your hand, then you start eating your food with that hand, and now you are sick with the same thing that they had. Most of the viruses that cause abdominal symptoms, things like rotavirus or norovirus, some adenoviruses, are spread by the so-called fecal-oral route. The next one I'll talk about is called contact spread. And it's related to the first one, but not quite exactly the same thing. This means that any surface that the virus gets on, say a table or a chair or a plate, something like this, is now coated with viral particles, and then other people can then touch those same objects, and then their hands become infected, and then if they touch any of their mucous membranes, and that's things like your mouth, your nose, your eyes, you can then spread that to yourself. Viruses that are spread through respiratory droplets, you cough and you sneeze, they're up in the air for a little bit, but then they fall down to surfaces, to contact surfaces, where they will then come in contact with other people if you're not careful, if you're not cleaning the areas that you're working with, if you're not cleaning your hands before you eat or before you touch your face. The next one I want to talk about is airborne spread, and this one is probably the worst because in this case, you don't even have to touch anything. All you have to do is breathe. We talked about measles being an airborne virus. So is the virus that causes the chickenpox, which is also called the varicella zoster virus. Also tuberculosis, which is actually caused by a bacteria called Mycobacterium tuberculosis, is also an airborne organism, or at least it can be under certain situations. There's a little bit of a distinction, and it's a little bit arbitrary, between something that is called droplet and something that is called airborne. But I'm not going to go into too much detail on that right now because we'll cover that in another video, so be on the lookout for that one. But the bottom line is, if it's up in the air and you're breathing it in and you don't have a mask or other proper protective equipment, then you could get sick that way. Another one that's not quite as bad is referred to sometimes as bloodborne, or in other words, an infectious organism or a contagious organism that is spread through bodily fluids. Now, common organisms to think about here would be the HIV virus, which causes AIDS. Another famous one would be the Ebola virus. These diseases can be devastating to people when they acquire them, and they can be fatal. But the good news is that they are easier to avoid, because as long as you avoid coming in contact with another person's bodily fluids, then you avoid getting sick. Now, some of these things are not terribly contagious, meaning that if you're really going to get them, you would either need to get them by sharing bodily fluids through, for example, sexual intercourse, and that does mean oral, anal, or vaginal. Any of those things would serve. or, for example, a blood transfusion that hasn't been properly screened, or obtaining them through sharing needles in the case of, for example, IV drug use, things like this. Others can be a little bit more contagious. A person has blood on their hands and you get some of their blood on you and you can acquire the disease that way. That's a little bit more contagious, and Ebola was a scary virus for that reason. But some of them, you really sort of have to work at it to get infected by them. The final transmission method that I will talk about is the cutaneous method, and this simply means that two skin surfaces come into contact. There aren't a tremendous number that are spread this way. Most microorganisms just can't do this, thank goodness. And assuming you wash your hands, which always helps. But there are some, such as Verruca vulgaris, which causes the common wart, and also the herpes simplex virus, which causes oral and genital warts, that can be acquired through just skin contact. And that's true even if there aren't open lesions or sores. It's just skin on skin is all it takes. So those are the basic methods as to how viruses spread or are contagious from one person to another, and how contagious a virus is determined by which route they spread, with airborne being the worst and something like bloodborne or bodily fluids being less contagious but still possible. And most others fall somewhere in between. Another factor that determines contagiousness besides the method of spread doesn't actually have anything to do with the virus itself, but rather has to do with its population of hosts, meaning us. And this is referred to as contact rate. Basically, this refers to how often the virus is given a chance to infect another host. Imagine you have someone who has the flu, which is caused by a virus called influenza. If that person, say, is somewhat of a hermit or a recluse and they live out in the woods somewhere, but they happen to get influenza when they came into town for some reason, they're probably not going to spread it to too many people, because they're going to go back up to their cabin in the woods and they're going to be sick, and they're either going to get better, which is most likely, or they're going to die of the disease, which is less likely. But either way, it ends with them. They didn't infect anybody else because they never came in contact with anybody else. But on the other hand, let's say you live with your large family in a small apartment building, and that apartment building has a whole bunch of other apartments, and you all have to share one elevator, and so you're in close contact with lots of other people all the time. In those situations, if those other people are not immune, either from a vaccine or having had the virus themselves that year, and assuming that people aren't wearing protective equipment like masks, that thing's gonna spread like wildfire. So contact rate has a big effect on how contagious any particular virus will be. The more people it comes in contact with, the more it's gonna spread. Pretty simple. Along with contact rate, you also have to consider how vulnerable your population is, and this is where we come up with the term herd immunity. It's kind of a funny term, but basically it means how many people in your population are immune to that virus. Let's say 80% of your population is immune to a given virus because they've been vaccinated or because they've already been exposed to that virus and they've built up an immunity. That means a virus is going to have a hard time spreading, because 4 out of every 5 people it tries to infect, it can't. And so it's much more likely to die out and not spread than if you have a population that has no herd immunity, which is why the COVID-19 virus has been so problematic, because we have no immunity to it. It's brand new, and it's going to take time to build that up. The next factor is related to that, which is the incubation period of a virus and the infectious period of a virus. Now, these two things, again, sound very similar, but they are a little bit different. The incubation period of a virus is the time between you first acquire the virus yourself and the time when you start to develop symptoms and you know that you're sick. So you picked it up here and you started coughing here. That time in between is called the incubation period, and this varies widely from virus to virus. Sometimes it's just a day or two, sometimes it's a week or even 2 weeks. It can be pretty long. The longer that period is, the more likely you are to infect other people, because you're walking around and mingling with them, not realizing that you're sick yet because you haven't developed symptoms. So this plays a big role. Now, the infectious period is a little bit different. This means this starts when you become contagious, which you won't necessarily know, and when you stop being contagious, which you also may not know. Now, the incubation period and the infectious period usually overlap, but they're not the same thing. You acquire the virus here, you become infectious here, you start having symptoms here, you stop being infectious here. They overlap, but they're not quite the same thing. But for both of them, the longer they are, the more likely you are to spread that virus along. Finally, the viruses themselves range quite a bit in terms of contagiousness. Now, this is a really complicated area to explain, and we'll get into it a little bit in another video on virology. But the very short version of it right now, if I can oversimplify and make some generalizations, is that some viruses are referred to as encapsulated viruses, and what that essentially means is that they are a bundle of genetic information, essentially RNA or DNA, that is packaged together in a little envelope of proteins that is mostly made up of glycoproteins and lipids. Now, if a virus happens to be encapsulated, then it is likely to be much more contagious. And the reason for that is that all of the things that that virus needs to get into your cells and infect those cells and then hijack those cells and start making new copies of that virus are usually included in that envelope. And that makes them much more presentable to the cell, much more accessible, if you will. So they're more likely to be contagious. On the other hand, if a virus is encapsulated, or if it has that protein envelope that we talked about, it also means that they're usually easier to kill. And the reason for that is most of the envelopes or capsules surrounding these viruses are very susceptible to things like alcohols or acids or bases, bleach, lysing enzymes, or they can fall victim to drying out or becoming dehydrated or desiccated. And once you lose that envelope, that virus no longer has the means to get into your cell. It's just a bunch of genetic information that's just sort of floating around. It's all dressed up, but it has nowhere to go. It can't do anything. So encapsulated viruses are usually much more contagious, but they are also usually easier to kill. On the other hand, some viruses don't have an envelope, and they're often referred to as naked viruses, and these are the opposite. They're harder to kill, but on the other hand, or harder to inactivate is maybe a little bit more accurate, but on the other hand, they are also not as contagious. So this plays a role as well. Whew. All right, so those are all the factors that determine how contagious a virus will be. Once we know all of those things, we now can start thinking about calculating the famous R-naught number for a virus. If you've been watching the show Contagion on Netflix, you probably already have an idea of what R-naught means. But if you don't have any idea what I'm talking about, R-naught doesn't refer to some sort of strange Shakespearean saying like to be or not to be, or the less famous are you is or are you not. Rather, it is the letter R with a little zero by it, and that zero is pronounced not. So R-naught. And the R-naught number is also referred to as the reproduction number. And what it really means is if you have one person who is infected with a virus, on average, how many people will that person go on to infect? If they go on to infect, on average, 2 people, then the R-naught value will be 2. If they go on to infect, on average, 5 people, then the R-naught value will be 5, and so forth. Now, if you stop and think about what this means, you'll realize that any value for R-naught that is higher than 1 means that the virus is spreading. It's getting bigger. It's becoming more of a problem. And even worse, it's doing so exponentially. If you guys remember that exercise where if you say, if I take 2 things and I double it, each time I double it, it becomes bigger exponentially, and it gets out of control very quickly. 2 becomes 4, which becomes 8, which becomes 16, which becomes 32, which becomes 64, which becomes 128, which becomes 256, which becomes 512, which becomes 1028, 24, and so on and so forth. It gets enormous really fast. Before you know it, you're up in the millions and the billions and the trillions. And let's say you started with an R-naught of 5. That means you're going 5, 25, 125, 625, and then whatever 5 times 625 is. Things get out of control really quickly. On the other hand, if an R-naught value is less than 1, that means that the virus is not spreading as much. In fact, the rate at which it is spreading is decreasing, and eventually, if that number stays below 1, it will die out. As you probably realized from this discussion, that means that the R-naught value doesn't stay constant, it changes. In other words, a particular virus doesn't have a specific R-naught value. Rather, the R-naught value is specific for a given virus in a given situation. And as the situation changes, or as the virus changes, the R-naught value will change accordingly. So let's maybe think about some examples. For measles, which again is one of the most contagious viruses known to man, the R-naught value ranges in certain scenarios anywhere from say 5 to 18, which is crazy high. And in some very specific, bizarre scenarios, it can be over 200. In other words, the average infected person will infect over 200 people each. I mean, that just gets ridiculous so fast. Imagine you have a barracks that is full of soldiers. They're crammed in there like sardines. They're sleeping 3 feet from each other. And let's say that none of those soldiers are immune to measles. They haven't been vaccinated like they should. Perhaps they lived before vaccinations were available. Or, and let's say that they're not practicing any sort of protection. They're not using any sort of PPEs or anything like that. If one of those people gets measles and you have dozens and dozens of them sleeping in one big room and they're all sharing the same airspace and they're all breathing the same air, it's going to spread like wildfire. But on the other hand, let's say you take America as it is today. And by today, I mean April 24th, 2020. Right now, most states have some form of stay-at-home order. Or at the very least, they're saying, you know, we're going to shut down large gatherings. We're not going to have concerts. We're not going to have festivals right now. We're going to tell people stay at home as much as you can. When you do have to come out, wear your mask, stay 6 feet away from other people. If you're sick, stay at home. Or if you're too sick to be cared for at home, go to the hospital where people are trained to protect themselves while they care for you, assuming that they have the protective equipment that they need. If you do these things, the R-naught value of any virus will drop dramatically. And that's why we've been doing this in America. That's why all these states have all these things. And I know it's hard. I know it infringes on your personal freedoms. And I know we're all getting cabin fever and we want to get back out there. But there's a reason for doing this. If you can change that R-naught value and you can bring it down below 1, it's going to get weaker and it's going to go away. And the best way to do that is to get a little distance between us, use protective devices like masks, and if you're sick, stay away from other people as much as you possibly can. And if we do that, this all gets better. If we don't, if we cram into big spaces, we all go to a big concert when, even just a few people are sick, it spreads like wildfire. Now again, this does change a little bit when you're talking about hospitals. I mean, let's face it, if you're in the hospital, it's because you're really sick, right? So everybody in the hospital is pretty sick. So your chances of getting sick in the hospital are higher. If you're a healthcare worker, if you're a frontline provider like myself and other physicians, hospitalists, other care providers in the hospital like respiratory therapists, nurses, CNAs, your chances of being exposed to and getting sick from a virus go up dramatically. But on the other hand, you are also trained in how to use personal protective equipment to keep yourself safe, which is really important, not only for your health, but for your families, and even more importantly, from the other patients. You don't want to be dragging a virus from one patient into another room with another patient. We're all trained in how to do that, how to make sure that we put on the right stuff, we use it accordingly, we use it properly, we take it off properly, we make sure that we then sanitize in between before we go into another room so that we don't drag it around and share it with everybody. And that's really important. So now that we've talked about all these things, what is the R-naught value for COVID-19? In other words, how contagious is this sucker? Well, if you've been paying attention, you know that it doesn't have an R-naught value that is constant. It's going to change, and it has changed already throughout the course of this pandemic. Generally speaking, when pandemics are brand new, their R-naught value is very high because there's no immunity and people aren't really sure what they're dealing with. And people aren't maybe isolating like they should at first, but as things go along, more people acquire immunity, more people are socially distancing themselves, wearing masks, that R-naught value drops. So it's not a set value, but if we were to say, what has it been for most of this pandemic thus far? It's been somewhere between 2 and 3. At times it's been up around 5 or even higher. At times it drops down below 1, but on average it's been between 2 or 3. Having said that, that number will be steadily improving as we continue to practice social distancing, as we continue to sanitize our hands, as we continue to avoid poking ourselves in the mouth and the eyes when we haven't sanitized our hands, as we continue to respect the space around other people. That R-naught value drops and drops and drops until eventually this gets better and finally goes away, and then life can sort of get back to normal, or at least until something like this happens again. But these things are really, really important. Now, to give you an idea, an R-naught value of 2 to 3 is worse than influenza, and an influenza is pretty contagious. But it's not nearly as bad as some other viruses out there, like chickenpox and measles. So, is it contagious? Yeah, but you probably already knew that. Is it worse than influenza? Yeah, or at least it is right now, because again, we don't have any immunity and we don't have any vaccines. But it will get better over time, and that's really important to remember. But if that's true, then why, if it's a little worse than measles, but it's not that bad, why has it been so devastating? Now, there are many, many potential answers to that question, and I'm going to get into that in another video because this one's already too long, and that really deserves some time all on its own. But I will say this, there are a couple of main reasons, at least in my opinion. The first is pretty simple. It's because COVID is brand new. We don't have any immunity. We've already talked about that. But the second is a little more complicated, and honestly it's hard to talk about because it's awkward. And that's the fact that the response, at least in the US, to COVID-19 was really bad. It was just disastrously bad. And I mean that on all levels of government and on all levels of our healthcare system. Again, it's awkward to talk about, but I think if we're going to learn from this, we have to be honest with ourselves. First, testing was disastrously inadequate. Again, I'll go into much more detail in another video, but it was horribly inadequate. And if you're not testing enough, then you don't know who has it and who doesn't, which means you can't isolate or quarantine effectively. Another issue is that personal protective equipment was just a disaster. A lot of hospitals just didn't have what they needed to keep their healthcare providers safe, which meant that they got infected, which meant that they spread it to other people that they were trying to help. And then another thing is misinformation. Oh my gosh, misinformation. The campaign of misinformation has been relentless. Now, I'm going to say the vast majority of this was not intentional. Most people, they're good people and they're just trying to get information out. But the problem is, if the information isn't coming from an expert, if it's not coming from a healthcare provider, if it's not coming from the CDC, then it may or may not be good information. And the more bad information we spread, the more damage that we do. And the more authority a person has, the more damage they can do because they have more of a voice. People will listen to them more. And if you take that logic and you run it right up the chain to the highest levels of government, and you have people that are saying things like, I don't know, this virus is a hoax, or, this Chinese virus will be down to 0 cases in just a day or two, so that's all good. Or maybe, yeah, this will all be gone by Easter. Things like that are terribly damaging because they give people the wrong impression, and then people don't want to do the things that they need to do to make this better, like social distancing and so forth. So misinformation can really be a huge enemy. So try to get your information from reputable sources. Thankfully, there are many. Get them from professional medical societies like the American Medical Association or the American College of Physicians, or there are plenty of others. Or get them from a licensed practitioner a doctor, someone like that, or get them from the CDC. Even the CDC, in my personal opinion, has made some mistakes through this, which is very unusual for them. Usually they are a very reliable source of information, but still they are a much better source of information than just something random that you read on the internet. So keep that in mind. Anyway, hopefully that this has been helpful to you and you've enjoyed this video. If you have enjoyed it, or if it's been of any use to you at all, please hit the like button and subscribe, or share this with your friends. It's really important if anyone's ever going to see this. If you do have any comments or questions, please leave them in the comments below. Again, I apologize for the quality of these videos. I'm new to this. This is only the second video I've ever made. I'm working on it. It will get better. But if you stay with me and you keep watching these videos, we'll keep taking this journey together, and we'll go through all of the things that we need to talk about, and we'll get there in the end, and we'll get there together. And in the meantime, remember, every day, try to find a way to make the world a better place. I'll see you soon.